Now this evening, the first individual to be honored is Dr. Myles Spar. Myles is the Director of Integrative Medicine. Myles, work your way up here, Tiger. He's the Director of Integrative Medicine at the Simsman Health and Wellness Center of Venice Family Clinic and the Medical Director of the Akashka Center of Integrative Medicine in Santa Monica, California. In addition to providing clinical care, Dr. Spar teaches residents and medical students as a clinical instructor at the UCLA David Geffen School of Medicine. He's most well known for his passion to care for the underserved and ensure that they have full access to integrative medicine. Having worked as a humanitarian with Doctors Without Borders in the field, and as well as the board of directors of the Nobel-winning organization, Doctors Without Borders has done spectacular work and well-deserved Nobel. Dr. Spar brings a broad perspective to his work. His view, and I think it's an important one, of his role as a partner with his patients, working with them to maintain optimal health and to invest in their well-being, is the model which so many of us are seeking to emulate. He has a strong commitment to improving access to all populations and a coordinated approach to health and care that focuses on improving vitality and wellness, not just preventing disease. Myles, please join us.
Ellen, can someone tell me which award belongs to? No, that's okay. That's all right.
There we go.
No, you stay here. Stay here. Myles, it is indeed our honor to present this award to you. You are the vision that Bravewell has for every one of its Bravewell fellows to become leaders in the field of integrative medicine, to educate, to inspire, to partner with, and to empower others to heal, especially the underserved in our population. Yours is a model for Bravewell's dream that integrative medicine be made available to every person in this country. And yours is also a model, we believe, that is the most critical component of the Venice Free Clinic, the largest free clinic in the country. So, we hope this award will support your commitment to the underserved and that you will continue to experience joy in the very critical work you do for those who need so very much. Congratulations.
Thank you so much. Thank you. Thank you. Hold on. Thank you. Wow. Thank you so much, Christy and Dr. Oz. I would be nervous if I wasn't surrounded by so much palpable love and excitement in this room. I just thank you all so much for being here, and thank you, Bravewell, an amazing organization. I also want to say how honored I am to share this award with Tracy. The work she is doing at the VA is truly remarkable and under-recognized by the community at large. She is really transforming the culture, as we know, of healthcare, and we should be shouting from the rooftops about it. Traditional Western medicine is failing our patients, and our doctors for that matter. For too long, our patients have been seen as collections of illnesses, especially our patients who are underserved. We focus on the most acute problems, and we train our medical students to focus on the most acute problems to the point where no one sees the patient. They're seeing the disease. They're seeing, as we heard from Tracy today, the chief complaint, and we're not seeing the whole patient, especially poor patients at clinic like ours who are used to not being seen. Instead, we could be putting out fires before they happen. We can be focusing on a bigger picture of health, and that's what integrative medicine is about. It's on focusing on helping the patients to be well, well-being. We have relieved the pain of countless homeless patients at our clinic suffering from back pain, pushing carts around with their stuff, who only had Motrin until they got to our clinic, and we were able to give them chiropractic care to relieve their pain for free. We have nannies who would have lost their jobs if not for acupuncture that helped their carpal tunnel syndrome so they could go back to caring the children that they were taking care of. We've taught stress management techniques. We've taught yoga, healthy dietary habits to our patients. I could tell you countless stories of patients like Sergio, a gardener who kept coming back to our chronic pain clinic until he had 4 Feldenkrais, yes, Feldenkrais at a free clinic, sessions that helped him learn how to do his work as a gardener without constantly getting into pain. For our patients, these treatments are not fancy, they're not luxuries, they are life-saving. I'm driven by the belief that integrative medicine is not elite medicine. Integrative medicine, thank you. Integrative medicine is the right kind of medicine that supports health and well-being, and is especially the right kind of medicine for those of us with limited access to care, limited resources, because it focuses on self-empowerment, on prevention, on utilizing relatively inexpensive tools to achieve better health. Things that don't necessarily require an MD or a DO or expensive pharmaceuticals or fancy tests. It's about complementary modalities, yes, but it's also about taking the time to listen, seeing the patient, not just the disease, teaching patients about stress and how to manage stress and the impact on the body of stress, educating about nutrition, brainstorming what physical activity might be possible for that patient given their circumstances. All of these are arguably more important than many of the things a typical doctor does because they can prevent the major challenges and chronic illnesses we see and yet cost relatively little. I came to believe this during my time with Doctors Without Borders. That's where I started my journey with integrative medicine. I saw patients learning to use whatever tools were available to them. Getting to know these patients, getting to know the importance of their community, of physical activity, of doing anything they could to stay healthy showed me there was a lot more in our toolbox than what I learned in medical school. I have to acknowledge that this award is not mine alone. First of all, there are other clinics like Venice Family Clinic doing this kind of work. There's 11th Street Wellness in Philadelphia. There's Greater Lawrence Family Health Center in Lawrence, Mass. There's Jeanette in Calgary doing her work. There are a lot of us doing this kind of work, and you can find out more through Integrative Medicine for the Underserved. But as for the work we're doing in Venice, first of all, I want to thank and recognize Nancy Rodriguez, who's over there, who has been our program manager and our research coordinator for 5 years. She's brought our program to a new level and is amazing and will be the best doctor one day, and I can't wait till that day comes, although I'll have to lose her. I want to thank Mary Hardy, who's not here tonight, but really helped get our program going once we got it off the ground. She was my mentor from the beginning and the first person I went to for guidance. I want to thank the executive director at Venice Family Clinic, who was open to our program from the beginning, even before we had funding, and was open to brainstorming about how this could happen. I also obviously want to thank our gracious financial supporters, initially the Sims Mann Family Foundation, and now our current anonymous supporter, who obviously we would not be able to provide the services we do without their support. But especially Bravewell. We would be nowhere without Bravewell. This organization, made up of some of the most successful and visionary people alive, set out to change the way healthcare is delivered and understood in this country. They embraced what we were trying without hesitation, knowing full well that having a community like ours as part of their work was essential to understanding the power of integrative medicine among all populations. But many, many organizations would not have done that. Bravewell brought us to the table literally and invited us to be part of the clinical network. The importance of that cannot be overstated. In inviting Venice Family Clinic to join the network, Bravewell showed that it stands for integrative medicine as a solution to the problem of access to health care for the United States population, not as a way to provide a higher level of care to those with money. It showed that it is committed to proving that integrative medicine can be used to prevent some of the health problems that disproportionately affect those with lower incomes and poor access to care. And for me personally, it validated and reaffirmed the work I do and the vision I've tried to pursue. Again, that integrative medicine is nothing less than the solution to the problems of our nation's healthcare system. But to whatever extent this award is truly deserved by me personally, I also have to share the credit. To my parents, Marcia and Harvey Spar, who instilled in me a sense of service, of responsibility above entitlement, not only in words but in actions. My parents have always valued giving back, to the point that I remember them speaking about others in our community as good people based on whether or not they were charitable people. And in fact, my father was a recipient of a very similar award to this a number of years ago with an organization called ORT. Throughout my upbringing, I was taught the value of tikkun olam, or repairing the world, and how we are responsible for doing our part in that. My husband, Danny, has always been a strong supporter of my work, even when I was leaving for months on end to work with Doctors Without Borders, which he calls Doctors Without Mercedes. And sure enough, we don't have a Mercedes. And most importantly, we are in lockstep when it comes to instilling in our children, Cleo and Canaan, go ahead, Canaan, the importance of seeing all others as equals, of compassion, and of using our gifts to make a positive difference in the world. Do you know that we not only have a waiting list of patients that want our integrative care, we have a waiting list of providers, volunteer providers who we don't have room to even house, who want to give of their time for free or for low cost, massage therapists, homeopathy providers, Reiki therapists, energy healers, who want to volunteer to see our patients. Because of that, through the funds from this award, I have founded a new nonprofit organization called Integrative Medicine Access, with the sole mission of promoting access to integrative medicine among those who can't or think they can't afford it. They will learn through our website what tools integrative medicine has that can help them. They can find out about integrative medicine approaches to their problems, and then they can find a therapist in there, or a practitioner in their area who will see them for free or low cost. Imagine being able to call a number or look on a website, dial in that you have chronic pain or back pain or arthritis and find what modalities work, see a video of someone getting acupuncture, a video of someone doing Reiki, and then finding a practitioner in your area who will see you for free or low cost. That's what we're building. I encourage you to go to the website and look at it. It's purely started through the grant from this award. I believe in the power of integrative medicine. This was instilled on me through my teachers, Victoria and Andy Weil. I've seen the power of integrative medicine. It empowers people who have been disenfranchised and made powerless, unheard, unattended to, mistreated even by our healthcare system. It tells them that they have power over their own health. They have options. They are not left out. That their traditions have meaning and a respected place in healthcare. Integrative medicine can be accessible and definitely is the solution. I am honored and humbled and so full of gratitude for this award. Thank you all so much for this.